A meniscus tear is a common knee injury that can limit your ability to move. The knee joint is formed from the thigh bone or femur, the tibia or shin bone, and the patella or kneecap. Between the thigh and the shin bones are ligaments that hold the knee together and fibrous cartilage that acts as a cushion. This cartilage is called the meniscus. The medial meniscus is often torn along with the anterior cruciate ligament or ACL and the medial collateral ligament or MCL. The meniscus is tough and rubbery, and it keeps the bones from rubbing against each other. The meniscus can be injured during a bending and twisting motion, such as during an impact like a sport tackle or a car accident. Common ways in which the meniscus can tear include a longitudinal tear, a bucket handle, a flap tear, and a radial tear. A meniscal tear can lead to knee pain, joint stiffness, or swelling, and a buckling or locking of the knee that prevents full motion. Surgery may repair the meniscus by removing a torn flap or by stitching together a tear. Therapy can relieve the pain caused by a torn meniscus and will help you regain movement in your knee. While you are healing, you may need to avoid painful activities like jumping, running, and twisting. Your therapist will give you a home program that includes stretching and strengthening exercises.